Hello.
Good afternoon, Dr. Fidi. It's so good to have you here, sir.
Hello. Are
Yeah,
you hearing me?
Yeah, I can hear you. I can hear you very well.
Okay.
All right. Thank you so much for joining us. All right, good afternoon, everyone. Welcome to the December edition of Get Webinar Series. My name is Ifeoluwa Alabi.
Can you hear me now?
Yes, I can hear you very well. I can hear you very
Okay.
well, Doctor.
When I shared my slide, did you see it?
Yeah, I saw your slides.
Okay. How are you?
I'm very fine. It's so good to see you again.
Well done. You're more relaxed now, unlike the last time we met in Lome. Hi, baby.
Baby is doing very well, sir.
That's fine. That's fine.
Thank you.
Well done.
Thank you, sir. All right, so the webinar is meant to start for 12 noon, and then we just decided to wait for about another 2-3 minutes to confirm the participation of our second speaker. So, I would like to tell everybody to please be on standby. We'll be starting about 2-3 minutes from now. So while we're waiting for our second speaker to join us, we have our first speaker here, Dr. Donaldo Fidi, and he's going to be engaging with us in a very rich discussion on our focus area for today's webinar. So we have our chat box open. If you want to drop where you're joining us from, you can actually use the chat box. I will still go on with the rules for the webinar shortly. I'm just still waiting for the second speaker to join us. Like I said, I'm hoping that he's going to join us anytime soon.
Hello, sir. Hello, sir. Yes, sir.
Hello, Ifeoluwa.
Is that what?
Yes, sir.
Do you want us to start or wait for the second speaker?
Sorry.
Yeah, we're going to be starting about in about 5 minutes. I'm going to introduce you before we start.
Who is speaking first?
Okay, sir.
We're hoping that Dr. Francis is going to join us, since his topic is focused on the background details on the topic. But just in case he's not joining us as soon as we expected, we can have you start lead the discussion. I'm just going to, we usually have some background discussion before we bring in our speaker shortly.
Okay.
So, sir, thank you so much for joining early.
Always keep this. So because of noise. No, it's okay. Yes. Thank you.
All right, thank you so much, sir. Thank you. Good afternoon, everyone. My name is Ifeoluwa Alabi. I'm officially welcoming us to the December edition of Get Webinar Series. It's been a long year for us. Here in Get, we've been organizing our webinar from the first month in the year 2023, down through to December, and it's just a good time to actually wrap up the year. I would like to say that it's been an amazing time with everyone. Thank you for joining us, to all of our participants. And you should know by now that Get Webinar Series is a big platform where we bring experts from different parts of the country to engage in a very rich discussion with respect to global health, emerging infectious diseases, and other related health topics. And we've been doing that around the year. If you have joined us, maybe you've joined us more than once or you've joined us more than twice, I want to say a big thank you. And they, what we normally say at the end of the webinar is that you can catch up with all of our series on our YouTube channel at Get Africa. And one of the things that makes Get Webinar series very engaging is that we have participants joining us from different part of the country. I mean, different part of the world, not just Nigeria, not even Africa alone. I mean, we've had several, our statistics have showed participants from different part of the world. I mean, from US, from Dubai, even from Pakistan, from United Kingdom, from Germany, from Togo, and we're very excited. I mean, this participation actually shows to us that the webinar is very rich, the webinar is engaging, the webinar is educative, and the webinar is enlightening. And we definitely want to also do a lot of appreciation to both our participants and to our speakers. And now we're focusing today, which is the December edition, and we're really need to wrap it up. I'm going to be also so, all right, thank you for having me back. I guess I had a little. So, and in short, we call it GET. And GET was established in the year 2014 during the Ebola crisis, when Ebola virus ravaged West Africa. And then what we stand for is that we build the capacity of policymakers, of the society, the community. We work with governments, to build their capacity towards combating infectious diseases and other future health emergencies. And we carry out all this through several projects, and of which one of our activities is the monthly webinar series, where we engage the public, we educate the public to know both the role and as well as the policymakers in understanding the role everybody has to play in combating the health emergencies, the future health emergencies, as well as the present one. All right, so this edition of the December edition of Get Webinar series is going to be focusing on review of health policies in Africa, implementation and advancement. And then we have two notable experts on board. I mean, I've been privileged to actually interact with two of the two speakers that we're having today. And I can tell you, they have one of the leading experts in the industry. And it's such a great honor to have them here. All right, before I actually bring them on board, you know how we do it. We have our chat box, because this is not just a talk webinar. Every of our participants also have the privilege to interact with our speakers. So please, you do have the chat box to drop, maybe you want to introduce yourself, you want to introduce where you're joining us from, as well as you want to introduce your organization. And also we have our question and answer box, which is where you get to drop your questions during the course of our presentations. All right, we do hope that this webinar is not going to be too long, because we know that it's already Christmas is in the year already. But at the same time, researchers and even the health community must still play their role, in the course of the festive period. All right, so I'm going to bring in on board our two speakers. Like I said, the Get Webinar series is going to be focusing on review of health policies in Africa, implementation and advancement. Before I actually bring on board our speakers, I usually lay a background to this topic so that it'll be so easy for our speakers to actually take it off from where I am. All right, so I have some things that I've written down here, and I want to say that at this point, it's so good that Africa has gone. I mean, we've made a lot of progress. Yes, I must say that, even though at many points in time, there's always a comparison between Africa and on the continent. But I would like to say that it's very good that we all give accolades to all the progress that we're making. I mean, I was privileged to be in one of the meetings in a multilateral discussion that hosts several stakeholders from different countries in Africa, on the continent. And you can't not deny that we're making a lot of progress. Yes, we're not where we want to be, but we are not where we used to be. And it's very important that we actually give ourselves accolades, both on the level of the government, as well as the policymakers, as well as the experts, and also the community at large. All right, so I have here, just to give an overview, you see me just looking down and literally looking at my notes so that I'll keep my thoughts in progress. I have here that when you talk about health policies are fundamentally linked. Health policies are fundamentally linked to public health, and they play a vital role in the general awareness and safety of a population. You will agree with me that over the last century, the most notable improvements in the population health were due to changes or improvements in policy. So you may agree with me that policy is very fundamental. Policy dictates how an improvement is going to be made, and also policy also dictates what to be carried out. All right, so I also say that I also have here that life expectancies has increased significantly because of policy, which are related to better sanitation. There are some policies that has to do with sanitation. There are policies that has to do with automobile safety. There are policies that has to do with guiding food security. And there are also policies that has to do with smoke-free air and other policies that are guiding the health sector and even the health system in general. And I also want to say that when it comes to public health policies, they also strictly refers to as laws. They also refers to as regulations. They refer to as actions, and they also refer to as decisions which are implemented within society. And when we're talking about society here now, in this context, we're talking about a continent. So this has to do with the laws, the regulations that policymakers are implementing day by day to guard, the health of a community or the health of a continent. And the purpose of these health policies are to promote wellness and to ensure that their specific health goals are met every year, or let's say, I'm privileged to also know that, every year, if not every year, like it will be or it could be in 2 years, it could be in 3 years. There are some health goals that are being, there are some health goals that are being set by policymakers, and in that regards, policies are being decided, or policies are being formed to make sure that those health goals are achieved. I also have here that health policies are multidisciplinary in nature, and when you're talking about in nature, in the sense that it crossed across board. It crossed across board in the sense that it crossed through not just the health-wise. There are public health policies that affect the political sector, and there are public health policies that affect even the cultural perspective of a particular country or of a continent. Now, I'll be wrapping up and saying that the development of effective health policies require extensive research processes to determine what public health issue needs to be addressed or what needs to be formulated to have subsequent solutions. And when we talk about policies, policy reach broader population and have a larger scope than individual level intervention. And then also, I would say that in Africa, for example, which is what we are considering today, we all agree with me that everything that is happening in Africa falls and rise on policy. After looking at all discussions that we have had from January right into December, a lot of our experts have given recommendations that there should be policy adjustments. And that's one of the things that we do, is that after we are done with all of our webinars, usually come up with a policy brief where we pass it to our policymakers so that they will know what is going on, from the view of an expert, and they will know the right policy to actually enact or the right policy to form. Well, when it comes to health policies, Africa is not doing too bad, but we does need to actually do so much in that respect. And I have here that in Africa, poor policy processes significantly undermine the quality of health policy, our decision making, and also it also affects the program implementation. And it's in this view we have brought together two experts who will be educating us, and will be enlightening us, and will be taking us on how we can, how better health policies can be implemented, and also with respect to the advancement of the health policy in Africa. All right, I have the privilege and I have the honor to bring on board two of our experts. I'm so excited. I want to say thank you so much, Dr. Ophili, for joining us. I also do have Dr. Francis there. So just like our culture, before our experts are given the floor, I always want to read their bio so that we can get to know them professionally, because I'm sure that as many people that are on this call, we have close to 50 people on this call already. A lot of them must have, maybe met them online, or maybe you've interacted with them in one of the conferences. I was privileged to meet Dr. Ophili in one of the conferences that I attended earlier in the year, and also I met Dr. Francis at I just concluded the 9th African Conference on One Health and Biosecurity, of which my organization organized. So I would like to read Dr. Donald Ophili's biography. I know it's quite long, but I'll find a way of actually shortening it. Presently, Dr. Donald Ophili is the director and the deputy registrar, the Medical Laboratory Science Council of Nigeria. Dr. Ophili is a medical laboratory scientist with over 25 years relevant operational and strategic level experience in diseases control and laboratory strengthening. He holds a PhD in hematology from Igbenedon University, Okada, Nigeria. He's a fellow of the Medical Laboratory Science Council of Nigeria. He's also a fellow of the West African Postgraduate College of Medical Laboratory Science. He's currently director and the deputy registrar of the Medical Laboratory Science Council of Nigeria, and he's also a WHO HAFRO certified strengthening laboratory management towards accreditation trainer. He's a he also possesses Clinical Laboratory Standard Institute. He has several, I might say that, when it comes to Dr. Ophili, he has several certifications and many more. He's also a member of the Nigerian National Laboratory Technical Working Group. He's the chair of the NLTWG Committee on Laboratory Quality Management System. He's also a member of the Biosafety, Biosecurity, and Laboratory Information Management. He chairs the Nigerian National Technical Committee on Standard for Medical and Medical Related Services with Secretariat at the Standard Organization of Nigeria. I also want to say that Dr. Ophili is well known across the continent. He has attended several capacity building workshops, which includes, quite a lot of them. Like I said, I was privileged to meet him at one of the conferences. I think I shouldn't say too much about Dr. Ophili, because his works and his expertise and also his certification and a vast knowledge and experience says so much about him. So Dr. Ophili, it's such a privilege to have you here. I can see your face and then I can see you as well. All right. So Dr. Ophili, you have the floor. You have the floor for your presentation, and I know that you can also share your screen. So thank you so much for joining us once again.
Thank you so much, Ms. Ifoluwa Alabi, for the introduction. And thank you, GET Consortium, for inviting me to share my thoughts on this particular topic. And I also want to welcome my brother, Dr. Francis Ohanido, who is my co-panelist in this particular workshop. He is of the African Public Health Institute. Thank you all for coming, participants, and you are all welcome. Having said that, I will now like to share my screen. Just a moment. Just a moment, please. Can you all see my screen now?
Very well, Doctor. Very well.
Okay, thank you very much.
You're welcome, sir.
Thank you very much. I am particularly very happy that we are going to be speaking on this particular topic. I met Ms. Ifolua Alabi sometime probably in September, and we discussed quite a lot about our continent and our country. And I was surprised when she now sent me this invitation to be part of this particular discussion. I'm also aware that this has been going on for some time now, and I'm happy to be here. So today we're going to be reviewing the review of health policies in Africa, implementation and advancement. And how this presentation outline, introduction, of course, status of implementation and existing health policies in the continent, what are the core capacities and infrastructure to support implementation, what are the challenges confronting us as a continent, what are the strategies for advancement, and of course, conclusion. By way of introduction, according to Business Day policies, policies are fundamentally linked to public health and play a vital role in general awareness and safety of the population. Over the last century, the most notable improvement in population health were due in part to changes or improvement in policy. Life expectancy has increased significantly because of policy-related issues, especially on sanitation, improved automobile safety, safe foods, vaccination, smoke-free air, and as the case may be. Public health policies refer to laws, basically regulations, actions, and decisions implemented within society in order to promote wellness and ensure that specific health goals are met. Public health policies are multidisciplinary in nature, as has been said earlier, and consider the political, economic, social, cultural, and lifestyle determinants of health. Let's look a little bit at the status of implementation of existing health policies in Africa. There are so many of them, but we just need to look at some. Given the many global and national efforts to improve health-related policies, organizations like WHO and US CDC, African Centers for Disease Control, and other governmental and non-governmental agencies emphasize policy change to make strategies, to promote strategies and make it more impactful and sustainable. However, despite these efforts, the implementation of public health policies in many low and medium income countries are extremely very low, and like those in Africa, are ad hoc. Some of these policies are implemented in a very ad hoc and fragmented manner due to resource constraints and variety of issues. In Africa, poor policy processes significantly undermine the quality of policy implementation and policy analysis, decision-making, and also ultimately public health programmatic implementation. Therefore, concerted efforts are needed to strengthen Africa's capacity in development of sustainable and evidence-based health policies. Now, let's look at briefly Africa's regional health policies and the global health security agenda. The global health security agenda was launched to accelerate progress towards a world safe and secure from global health threats posed by infectious diseases. And of course, there are key meetings and policy changes. One is the Maputo Declaration in 2008 on strengthening medical laboratories. Of course, there are World Health Organization's Regional Office for Africa, WHO Afro Resolution 52. We also had the stepwise laboratory quality improvement processes towards accreditation. These are policies that are also known within the continent. There are strengthening laboratory management towards accreditation program in 2009. And of course, laboratory is so key in public health, because if you're able to develop the capacity to, first of all, prevent, detect, and respond to public health diseases of importance, then, of course, you'll be able to have a strong health system. Now, let's look at briefly the WHO International Health Regulation Joint External Evaluation Tool. WHO have used this particular tool over the years to review health policies within the continent. And I remember in 2017, when Nigeria had its first JEE, we didn't perform as well. We had about 39% overall. The thereafter, in 2023, we just had the JEE in 2024. In 2023, in October, and Nigeria was able to move from 39% to 54% that we now have as a country. And that is our score presently. And let me say a little bit. In May 2005, the 58th World Health Assembly adopted the International Health Regulations, IHR 2005. Hereafter, refers as regulation, which entered into force on the 15th June 2007. The IHR requires all state parties to develop certain core capabilities related to capacity to detect, assess, notify, and respond to public health emergencies. And of course, this joint external evaluation has 19 thematic areas. And if you're able to do well in these thematic areas, therefore you're able to develop the resilience to respond to infectious diseases when they do occur, whether they occur naturally or they are deliberate, or somebody or it's accidental. You have the capacity to respond to some of these public health emergencies. And this JEE is able to help countries to support countries in assessing IHR core capacities and facilitates the reporting of some of these, implementation within the country. Secretariat of the IHR is hosted by the WHO, as I said earlier, and it has a monitoring unit and monitoring and evaluation unit for these called IHR MEF. And there is a reporting tool. There is annual reporting tool for mandatory reporting of these thematic areas. But of course, there is also the voluntary reporting by member countries. The way WHO operates is that it will give you the leeway to have your internal assessment. Then thereafter, you report that, and thereafter the WHO will come with external assessors to assess what you have in your country. Of course, as I said, the ability to prevent, detect, and respond to public health emergencies. And let's look at a little bit at some notable health policies in Nigeria. Of course, some of you will remember our National Child Health Policy. We have the National Gender in Health Policy. We have the Nigerian National Medical Laboratory Services Policy. That are some of the policies. Nigerian National Essential Diagnostic List, National Biosecurity Policy and Action Plan. The question you will ask is, what is the level of implementation of some of these policies, whether at national level or at continental level? Now let's look at what are the core capacities and infrastructure required to support effective implementation of health policies in Africa. Of course, we have the universal health coverage. Of course, this is the ability of countries to provide quality health services at affordable rates without citizens suffering some catastrophic health spendings. So it's important that countries are able to provide basic medical services without hardship to the citizenry. Of course, we have governance and organization. Is the ability of countries to actually coordinate the activities within health system to be able to respond to public health emergencies. And of course, you're able to have a tiered laboratory, a tiered laboratory or health network structure within the system. And of course, issues of supply chain management, in vitro diagnostic device regulation, equipment management, and quality management within the health system. What are the challenges confronting effective implementation of health policies in Africa? There are several challenges that we can actually put forward, but we have a few to actually mention that limit successful implementation of public health policies in the continent. They include, but not limited to: one, human resource capacity constraints at individual or at organizational level. And of course, we need to actually build capacity to be able to respond to public health emergencies, and of course, to be able to have a resilient health system within the continent, even at national level. And of course, budget constraints. We are operating a resource limited continent, and the resources are so limited that we are not effectively able to fund some of our budget heads. And of course, communication gaps. There are a lot of policies out there, even at WHO level, at African Union level, even at African CDC, but it is communication, effective communication that will make people know about some of these policies. And of course, poor networking between policymakers and researchers. There are a lot of researchers out there, but researchers are not able to take their works to the industry. And even policymakers are not aware of some of these research findings and use it in decision making. Of course, non-involvement of healthcare recipients in identifying and delivering and identify some of these health system needs. And of course, if we're unable to carry the community along in prioritizing healthcare needs, of course, implementation becomes very, very poor. Now, what are the strategies for advancement of health policies in Africa? One, collaboration is very key, and partnership. Of course, with the private sector, will enhance adoption of best practices for policy management processes. And of course, we cannot continue to underestimate the power of collaboration and partnership, especially with private sector. You agree with me that when COVID hit, that the private sector played a pivotal role in mobilizing funds for combating COVID. So we cannot underestimate the power of private sector in coordination and mobilizing the needed resources. We can't leave it for government alone to mobilize resources in public health. Increasing involvement of health recipients in policy-making processes. Of course, as I said, community participation, community engagement is very key in actually moving forward in implementation of relevant health policies within the continent. Because we need to strengthen researcher policymaker partnership. Of course, we need to be able to take our research, basic research findings to town, to the industry, so that it can help the citizenry. Of course, it's not enough to have a research finding, but if policymakers are not aware of some of these research findings, of course, it will not benefit the public. Of course, engagement with the media, both print and electronic media, is very key, because the media will help in enlightenment of the public. If these policies are not well talked about, if there is no conversation around these policies, and of course the citizenry will not be aware of these policies, and even the policymakers are not able to focus on some of these policies and use some of these policies for decision making. In conclusion, effective public health policies are needed for promotion of healthy lifestyles, disease and injury prevention, detection and prevention of diseases, and appropriate response to some of these diseases and all diseases. And they are essential to achieving Sustainable Development Goal 3. And of course, good health and well-being in Africa. Hence, African governments and relevant stakeholders must take action to ensure public health policies are implemented in a sustainable manner, and they are, of course, they are Africa focused. I would like to acknowledge Loan Public Health. I use some of their materials in this conversation, and of course, MLSCN, Federal Ministry of Health, of course, Africa CDC, and of course, WHO. Thank you very much for listening.
All right, thank you so much, Dr.
Any questions?
Yes, we're going to be having questions. Thank you so much for that rich conversation and presentation. We're going to be having questions, but the question is going to be after the second speaker before we go straight to the question and answer section. All right. Okay. This is what we just had. We just finished having Dr. Ophidi's presentation, and he took us right from the definition of health policies, and also there's something he actually mentioned in this presentation that actually coincided with what I have actually said in the beginning. From when I started introducing the topic, I did mention that we need to start giving Africa, our continent, the flowers. I know everybody want to criticize that Africa is not doing well. And looking at what Dr. Ophidi said, which is one of the country in Africa, which is Nigeria, for example, looking at the joint that in the year 2017, we used to have 39%. And looking at the year 2023, we have moved from 39% to 54%. I mean, looking at that gap, that's about let me put my maths into action. That's about he also mentioned various, quite a lot of the health policies, the various policies that we have that is governing the health sector. He mentioned several of them, and I'm sure, sorry, I just had to also record. Okay, there's a lot of disconnection. There's a communication gap between the health sector and the policymakers. So the policymakers is not aware of the research that is going on by the scientists, which are the ones identifying the various gaps. And also, the researchers cannot also are finding it difficult to actually communicate to the policymakers. And that's one of the reasons why we're actually having this webinar, because for the past 2 years that we're having this webinar, we've even brought policymakers to also come and engage with our researchers. And we're hoping that through this webinar, we can continuously also bridge a gap. And I also love I love your conclusion, sir. Thank you so much for that. I will say that thank you so much for taking your time to actually come and enlighten the public. And I'm sure a lot of our participants, our participants have lots of questions. And we're also hoping that, unlike what we usually have for our webinars, it's only our speakers that can actually talk and the moderator. But we're hoping that in the course of today, we can be able to give, if not one, if not two, at least 3 people to able to use their mic and ask their direct questions. Ask their questions directly. All right. So before we go on, let's go on. Before we actually, let's go on to the second speaker for today. And I'm so excited that we have the second speaker for today right on the call. Dr. Francis, I really don't want to call I don't want to call the surname so that I don't murder it. It will be too good of me, because and I'm super excited to actually see Dr. Francis once again. I've been part of there was a program Dr. Francis actually pioneered, from his organization, and I was excited that I was part of the participant then, and it was very rich. When I saw him at the last conference, my organization conference, I was a bit starstruck. So Dr. Francis Ohanyido, yes, thank you so much for coming once again. All right, before I bring Dr. Francis right on the call, I would like to actually read his biography so that we can get to know him very well. We can get to know him professionally. Dr. Ohanyido is an adjunct professor and he's also a physician and a development strategist with 2 years decade of roles in international inquiries and in public organizations, and some of the roles which are with some of the world's leading development organizations with strong multi-country experience in sub-Saharan Africa. Dr. Francis has had a stint with the United Nations agency like UNHCR, UNICEF, and WHO, as well as the bilateral bodies like USAID, DFID across Africa to improve the health of women and children in both development and humanitarian settings. He has also served as Sabine Vaccine Institute country advisor for the Global Network for Neglected Tropical Diseases and Support Vitamins Angels. a global micronutrient leader as the consultant country advisor for Nigeria. I'm also glad to let us know that Dr. Francis has served on several boards and working groups. He's on the governing council of the Academy of Learning Nigeria and the Global Malaria in Pregnancy Working Group. He's a board certified physician and he holds a medical degree from the University of Jos with postgraduate education in public health. He's a certified professional management manager at the Nigerian Institute of Management and also has a postgraduate qualifications in administration. Dr. Francis is a fellow of the UK's Faculty of Public Health, FFPH, is a fellow of the UK's Royal Society for Public Health and a fellow of the Academy of Public Health. He's currently the Director General of the West Africa Institute for Public Health, WAIPH. All right, sir. Dr. Francis, it's such a great exam. With so much excitement. We are excited to have you on the call. All right, I know you can see me because I can also see your face. So Dr. Francis, can you hear me? I know you're muted.
Yeah, I can hear you. I think I can hear you. Can you hear me?
Yes, very well. I can hear you. I can see your face. I can hear you. I can see your face. All right.
Yeah.
Okay, Francis, all right, I'm just going to be giving you the floor for your presentation. Thank you.
Okay, thank you very much. I think I need to apologize that I joined a little bit late. It's connectivity issues. But I'm here, so I'll just try and do what I can do. But the slide I'm going to present, I had to remove a lot of the pictorials and graphs because I didn't want it to also slow down your ability to have this discussion with me. And I'm very happy to be here. This is my second time on GET, although I've been on GET's platform in different forms, but as a panelist, I think this is my second time. And I'm happy to have my brother, Dr. Philly, with me here. And he's basically done all my work. So what is just left for me is to come and say Merry Christmas and Happy New Year to everybody before then we can now continue the discussion. But on a more serious note, I think he's done a lot of justice to his presentation. And what I'm going to try and do, because my topic actually is to look at the stakeholder side of policy making, and that is very critical. And let me see if I can just pull up my edited slide, the deck that I had to remove a lot of the pictures so that and make it as skeletal as possible. Let me see if I can pull it up. Yeah. Sorry. So basically, I think one of the things I'll try to also do is to look at system is pretty slow. So one of the things I'm going to try and do is to look at let me see. Are you seeing my presentation? Is it coming up?
No, sir, your presentation is not up yet.
Yeah, the network is really bad. So that's exactly what I'm actually worried about.
First, do you want to send it to Horst? Do you want to send it to Dr. Dot's email?
Okay, so maybe let me start off so that I can also, while in the process, rather than wasting time, to share it via email so that we don't waste time on this. Okay, so basically, I'm here to discuss about stakeholder work in terms of looking at advancement of policies. And I want to talk about advancement, really. Advancement is the idea or the concept of around policies in terms of how you promote it, in terms of how you shape it, in terms of how you implement it. So what it means is that the follow through from beginning to the end of policy process is something that we'll be looking at in terms of the role of stakeholders. And I'll start by just talking around why it's important in the first place for us to look at these issues. As Dr. Philly has mentioned, most of the things around policy itself. Policy is part of the enabling environment, it's a construct in terms that it helps us to understand what we're doing in terms of how we articulate ideas that govern our existence as a people or as a society, as a community. So you have policy on one side, you have, that's in terms of the enabling environment, you have policy, then you talk about advocacy, then you can have cross-cutting issues that are multidisciplinary, things like gender, things like even the idea of learning could be part of it, in terms of how you look at the enabling environment. So generally, when you talk about the critical importance of policies in addressing healthcare needs of Africans, I think that is very, very important. And I'll toe the line of the previous presenter and tell you that basically that without policy, we will be doing a missionary journey without direction, and it's very important that stakeholders are involved in policy shaping and implementation. And one of the stats I'll pull out is the fact that WHO actually has even discussed the fact that effective policy making can help in terms of deaths globally if policies are made in such a way that they should be. And that's a projection. And then the other side is that impact of policies extends beyond healthcare. And if you look at policy making, health is determined by a lot of issues that are brought on it from different areas. And one critical one is how the economy of a society or a country or a space can affect health. And for instance, there's this projection too that has been said that for $1 invested, it can yield you $9 in terms of economic returns in Africa in terms of health. So because health is an investment destination, and in order to make it worthy of that destination, you have to have overarching policies that guide it. And when you look at the issues of healthcare policy, you'll be looking at healthcare policy from the layers of the highest level, which is legislation. And I'll give you an example. Some of these are based on my experience because I've had the onerous experience of having worked with the National Assembly, both at the Senate and at the same time at the House of Reps at various points in my life. I was an advisor to the Senate Committee on Health, and then later senior technical consultant to the majority leader of House of Reps of Nigeria. And I was actually part of the whole process that midwifed the coming into existence of what is known as the National Health Act in Nigeria. And of course, there were a lot of politics then that involved different categories of stakeholders. And I'm sure Dr. Philly will remember some of the heated discussions that came up in terms of around those from the health side of the device in different forms and all that. So these are very important because stakeholder is about everybody, and if you're bringing out any form of policy, policies are not in themselves built in lacunas. They are built because people want them to exist, to be able to listen. And the more stakeholders are involved in a sector like health, the better for that policy because it gets input from everybody that should be part of that. And particularly the community level, because civil society organizations are supposed to be representative of and mouthpieces of the society in terms of the people at the bottom of the social pyramid. And they represent their interests, they represent their voice, and they help hold systems accountable for whatever is done. So that in perspective, So when you look at the key challenges in terms of health in Africa, they've been mentioned also. But I need to emphasize that because we have series of challenges that are evolving, a lot of them are moving targets. It's important that we keep having to re-engineer health policy shaping systems in such a way that they're evidence-based and they speak to the reality of our times. For example, the continent is still grappling with a large burden of infectious diseases such as malaria, tuberculosis, HIV/AIDS. And we are seeing an upsurge of tuberculosis. And even during the COVID pandemic, a lot of reports around tuberculosis were very, very, very much around in terms of the issues around it. And it became very worrisome for everybody. So even though we had, to an extent, felt we had reined in HIV/AIDS to an extent with the coming of with the antiretrovirals and all that. But we're seeing certain changes in terms of patterns, in terms of how HIV/AIDS presents. And we're seeing that a lot of young people now are becoming infected by HIV/AIDS, so, and so that demands that we should re-engineer our policy systems in such a way that it speaks to that. So, and then when you look at the rising prevalence of non-communicable diseases in our environment, because we are becoming more westernized, it's becoming a problem. And coupled with inadequate infrastructure and health workforce shortages, a lot of people, as are Japan to different lands, we're beginning to have serious systemic issues that is compounded by all those challenges. And then, worst of all, our environment in terms of clean water, access to clean water. Most Nigerians are actually their own government when it comes to water supply. They have borehole or they use well or something. Very few houses these days have direct pipe-borne water, that provides them potable water for them to be able to be sure of in terms of the quality, in terms of a lower disease load because of the agents that are like chlorination that are done for that process. Then, of course, nutrition is being exacerbated, creating different layers of health disparities. And it's worsened by the fact that if you look at the climate change, especially in the Sahel belt of Africa, you find out that a lot of families are going into more and more into poverty because their lands are getting denuded. Desertification is taking over the Sahel. And 10 states in Nigeria actually are brought into the Sahel, in another part of Nigeria. So we run the risk of having even expanded issues around public health nutrition in the years ahead as population grows and all these inequities are there in the system and all that. So the other thing too is that we need to understand that if we address these multifaceted challenges, it requires strategic and comprehensive approaches which can be garnered through a policy environment. And the other side of it too is that we need international collaboration to ensure that there's equitable and sustainable improvements in healthcare across our continent, So, and in terms of the significance of stakeholders in all these things, that's the question somebody will probably ask me. Why are stakeholders? Why are stakeholders? Why doesn't government just make this law, So the point is this, stakeholders, like I've also mentioned in passing, are pivotal in terms of advancing health policy because it encompasses government entities, it encompasses different interest groups, whether healthcare professionals, whether communities, whether private sector. So you cannot do it alone as government. You need to have input from all these people and different stakeholder groups that are within that setting to be able to make sure that your policies speak to your needs as a society. And then, of course, there's also the collaborative element in terms of ensuring that that layer of alignment of policies are such that it dovetails into our development needs. And because more stakeholders are involved, it also leads to effective implementation and sustainable impact. And by actively involving stakeholders, having them actively involved, you can actually be able to have health policies that can address diverse needs. And it's more equity-driven and enhances accessibility and fosters collective commitment from all the people involved in that system. So government and policymakers is the first layer in terms of stakeholders when you're talking about policies. And I've worked at different forms. I've been a TA to government in different countries, and I've also been part of support to the legislature. And I can tell you that government and policymakers are actually the architects of effective policy shaping and foundation for public health well-being if they are supported by other stakeholders. Left alone, they will not be able to do things the right way, and there may be other issues that may compound the ability to give you the kind of legislation you want. I'll give you an example. In 2002, there was a senator called Rose Omu. She came up with the Violence Against Women bill in the National Assembly. And this bill went first, second, and it was killed because some people didn't understand it. And they felt that it was going to be a problem for men, so they killed it. And the Violence Against Women bill never the same. But in the process of trying to get traction for that bill, one of the things I did was I actually worked with a couple of non-state actors to support it. And what we did, like then there was this UNIFEM, which is now the UN Women, which it was now converted to UN Women as a UN agency. They worked with a couple of them. What we did was, in order to sell this bill in a way that is wholesome and for them to appreciate it, although it was never passed, but in that process, we had to come together as stakeholders to be able to show, one, the reproductive consequences of battering and an effect on gender-based violence, because it's really for women, But gender-based violence also has also men. And we need to also put that picture that it's not only women. So when you pass a gender-based law, you were not going to be passing a law only that gives women a sense of caring, and gives them some form of restitution, but also men who are also in that, there are men who are battered by their wives or their spouses in one form or the other. So we made that case, and that helped us because it wasn't tilted to just only seen as just a women's thing, So it helped even gain some level of traction until it was killed anyway. So these things are very important because how you make laws, how you make policies at the lower level, whether in forms of guidelines, in forms of all this, if you don't drive them through a stakeholder model, you are likely to grow some form of resentment to it, or even tackle issues related to resistance to change to it, So you need to bring those things in terms of this. The other stakeholder group that I need to mention is the research community. Dr. Philip talked about the issue of the gap between R&D, research and development, while in the academia and all that, and then industry, all those gaps are there. It's very important that when you are going through the process of putting in place policies, that the research element is there, and the research community is deeply involved because they are the ones who can help you do your analysis, follow up, and also help you build an implementation science framework, which is where the world is going now, to be able to track the quality of your policies and how these policies are able to speak to the reality of your time. Because policies also change because of what we call realism can play its role in terms of how you approach policy and how you're able to implement it and all that. So things change with time, like every other thing. So you need to continue rigorously studying and innovating around these policies so that in such a way that it's the information you garner is able to contribute to essential knowledge and informs further policy development and ensuring that decisions are grounded in the latest scientific understanding as we know it. So because even science is organic, it changes. Some days ago, I remember some years ago, I learned that there were about 70 moons on Jupiter. Only for me to wake up like 2 days ago, I came across that Jupiter had 95 moons now. So these things change. Information change every day. So we need to be abreast with these things. And one of the things that academia can bring in and the research environment, one of the things like my institute does is to support around collaborative efforts to drive progress towards healthier and more resilient society. And this can only be done when you have evidence, when it's evidence-based, when there are nuggets that are enshrined in it that enable you to learn from the policy process, the policy shaping, the policy implementation, and also coming back with the voice side of the people. Because it's all about the people. If the people can't give you feedback on your policy, then that policy is as good as being on Jupiter, depending on one of the moons. So these things are very important so that we understand that they are very critical. So the other group is civil society and advocacy groups. In this group, I also include the media, because they are the fourth estate of the realm, and they are like ombudsmen of the system in terms of information and getting information and sharing it, and demanding also accountability like civil society and advocacy groups. So they are together in this group. And what they do, civil society and advocacy groups are instrumental in shaping health policies by amplifying the voices of communities, like I mentioned earlier. And they are grassroots efforts to raise awareness, advocate for equitable access, and hold policymakers accountable. And this is very important. And one of the things we did in Nigeria, I can also remind you, when the National Health Act was passed in 2014, when President Goodluck Ebele signed off on the National Health Act, one of the challenges we had 2 years later, by 2016, there's no money put there for National Health Act. The implementation had not started. And then, of course, one of the biggest gorilla in the room was the Basic Healthcare Provision Fund, which is actually a catalytic fund we had included in the National Health Act to be able to be like a signature from the federal telling the states that, look, well, with you, primary healthcare is everything. If we don't have it as a cornerstone of our health system, then we have a problem. And it's supposed to be not less than 1% of our consolidated revenue of the federation. So it's a first line charge. But for the first 2 years, that money was nowhere to be seen. So we had to come back together as civil society with partners and begin to drum the drums of war, in terms of getting the government to sit up, because it was already an act of government, and government was flagrantly ignoring it. So at the end of the day, we're able to get that included in the Appropriation Act of the following year, 2017, and going forward now, it becomes part of our appropriation generally. So you see how stakeholders can play a role, and a lot of it involved engagement with National Assembly and structures like what is now known as the Legislative Network for Universal Health Coverage, LNU, came into existence. And it's still existing, because we begin to shape how we model our legislative health agenda, how we put it across in such a way that it's sensitive and responsive to the needs of Nigerians. Such things are very important. So this ability to foster dialogue and mobilize support from these groups are very important when sometimes you enter a lacuna with your policy. So then the other group are philanthropic organizations. These are novel. They've existed for a long time, but the model of their input into health-related development has never been as organized as it is now. You have all the Dangotes now with foundations. You have BUA, which is foundation. You have all sorts of foundations that are popping up, because our billionaire class, a lot of them now feel responsive, to be able to look at using instruments of social responsibility to be able to drive an agenda. And some of this agenda includes funding advocacy streams for policies, for enabling policies, and to support responsive policies, like Ophelia mentioned about how the private sector galvanized during COVID. And that private sector included the instruments of those CSR of some of these people, like BUA. So some of those are things that help us to make sure that stakeholder involvement in policy making and shaping and implementation, what you call advancement, it's more encompassing and stronger, and also can support innovative initiatives, and also in some cases drive research and enhance healthcare infrastructure. Now I know the group in Lagos, Private Sector Health Alliance, which is chaired by Dangote, and party co-chaired at and Jimovia also, is now adopt a primary healthcare facility program. So some of them are being adopted by both corporate bodies in terms of corporate social responsibility, or individual philanthropists too, across communities in Nigeria, which is also something that is very important. So what it now needs is that for government to recognize this and probably develop a sort of a policy around mixed financing or blended financing and philanthropy in such a way that it speaks to our evolving environment. Because currently, there's really no this. There's some programs like malaria have a private sector strategy, but in the whole, a private sector engagement that includes philanthropy and individuals is still yet not born in Nigeria. We need to begin to think of policies that speak to that. And that's the same thing across Africa. You know, you have all the CPAs in South Africa and all that. So these people are galvanizing towards putting their money also in development. And so it's good that we also have policies that speak to those things, you know. So the other thing is the other group, or last of all, we talk about yes, private sector and collaborative partnerships. There are different wings of it, you know, and different planks of approach, you know. So you can talk about public-private partnership. That's one plank. You can talk about public-private philanthropy partnership. There's also public-people-private partnership, where communities are actually signatories to those partnerships, you know. And if you look at the compact that was signed in the Villa last Wednesday around this investment in healthcare that Professor Pate is pushing now in Nigeria, you'll find out that if you look at the spectrum of signatories, it looks at government, it looks at development partners, it looks at communities, it looks at private sector, it looks at other NGOs, you know. So it's actually all of sectors, you know, in terms of the approach, in terms of those signatures that came on that compact. So it wasn't just federal government and states alone, but it was witnessed by other major stakeholders in the setting, in the Villa, which some of us were privy to be part of that event. How it will end up in the long run is still open. The jury is still open there, but we are hoping that it's a signature towards better things for the health system, policy, and implementation in Nigeria, because the current government is looking at a sector-wide approach using the basic healthcare provision fund as the kernel to be able to mobilize funds and pool funds in such a way that they can galvanize it to do more work at primary healthcare and other layers of the health sector, like emergency, including epidemic response and all that. If you remember, there's a 5% of the basic healthcare provision fund that speaks to emergency, which may include ambulance, also part of funding to CDC, Nigeria CDC and all that. So this is a way that private sector and collaborative partnerships across board can come in. And private sector brings a lot of energy, you know, so it helps in terms of also helping us to bolster access to quality of services, ensuring holistic approach to health policy, and also combine strengths of both it for itself and other sectors it works with for sustainable and impactful outcomes. And you know, so one of the things I said to pull up here is, and Dr. Philip talked about it, also in the presentation. I just want to emphasize that we need to look at, when we talk about policy, what are the barriers to implementation and what are the strategies we need to in. So the basic problem with policies, you will always hear in almost every meeting you go to, especially in Nigeria and a lot of other African countries have been privy to this, is the fact that, and if you have also attended the Conference of Public Health in Africa, which is the largest conference of public health in Africa, one of the largest in the world. We just had one, about 2 weeks ago. We just concluded one about 2 weeks ago in Lusaka. And if you sit in some of the panels or you are part of the audience, one of the things that keeps coming around policy is the fact that we make all the beautiful policies, but when it comes to ground zero of implementation, we are challenged by one kind of tiger that seems to tell us, oh, don't implement for some reason. So we need to begin to be an Africa we want that implements policy. It's not just paroles policy, develops policy, shapes policy, but implements it. And this is where stakeholders are very important, because the more you involve stakeholders and they own these policies, the more they are likely to help and nudge government to be able to implement some of them and make sure that also some of them be part of that implementation in terms of health policy advancement. So some of the strategies we could look at in terms of overcoming some of those barriers are like ab initio, the stakeholder engagement. I mean, you can't do policy these days, stakeholder engagement, when you don't talk about human-centered design approach. It helps you to be able to granulate around what stakeholders really want and what's the best way forward or the best buy in the course of negotiating for any form of health policy or any other policy whatsoever, And also, it also fosters interdisciplinary collaboration and it prioritizes resource allocation so that we don't keep filtering resources into zones that we don't even know what they are. So if you look at the health system, part of the challenge with the health system is not about financing. People make financing pillars the cure-all of the health system, and I agree vehemently because the problem with the health system is that we have a lot of hemorrhage. What we need to do is get more health for the money, and we can only do this if there's transparency and accountability. Here again comes where the other partnership of collaborators should come in to hold government, hold agencies, hold implementers responsible so that they are more transparent, they are more accountable to the system. If that happens, you will get more resource for health. It's not only throw money into health, but also get what is worth for health. So more health for the money is something we should also be prioritizing in Nigeria and everywhere else in Africa. So, and continuous evaluation is very important because health is an adaptive space. And when you plan, you must be able to leverage also things like technological innovations to ensure policies are agile, responsive, and in a larger sense, effectively contribute to the improved healthcare outcomes of the people. And this is where I say implementation research becomes very key, because the good thing about implementation science generally is that it is organic and it flows with the activities of implementation. It is not a research that just do like a cut through or a snapshot, no. But it's a research that continuously is adaptive with your planning and leveraging on all the innovations you have designed, also giving you feedback in such a way that in real time you can be able to be responsive to the needs of your program. So it's critical in terms of addressing barriers and strategies for it. Then the other thing I want to also talk about is health policy evaluation and monitoring, which ties into my last point. So when you develop, and then Ibolua also mentioned when she was being her intro, the issue of health policy and how we track what we've done. We need to have systems that are such that our health policy evaluation and monitoring speaks to a tracking system so that when we have any form of health policy, we're able to evaluate and monitor it, which are key indispensable components of successful policy advancement. We cannot be talking about policy advancement when we cannot effectively track, evaluate, and monitor our health policies. There are no health policies in the shelves. Some of them have never even left the shelves to ground zero. At a point, I started a program when I was working for USAID Compass Project. One of the things we did with the team was to develop what we called policy comments. And in the states we work, we try to get some of the health and education Compass or integrated projects of the USAID's flagship integrated project. So in some of the states we work, like Bauchi, Nasarawa, Lagos, what we tried to do was to see if we could get copies of some of the policies then and get them to local government chairmen to have copies of some of those policies. I don't know where that's happening now, and I don't know of any organization that made that kind of effort to get policy to that level, because they need to see these policies. You can't keep talking about policies in Abuja and the people downstream don't even know what they're talking about. So they need to see it. They need to be able to be grounded in it, so that they can be able to give you feedback effectively about what they're doing with it, how they've responded to it, how they have acted on it, how their people have benefited or not benefited from these policies, because it's very, very critical. And, so I want to look at some case studies in terms of, in past article, I mentioned some things about my own personal experience. I'll probably mention the National Health Act again. somewhere along the way. But the case study, one of the first case study around stakeholder advancement of health policies, Rwanda. There's what is known as the Rwanda Community Health Worker Program. In Rwanda, and what happened was that there was a collaborative effort in the government, local communities, and NGOs that led to successful implementation of community health worker program. So the community health worker program in Rwanda is not only government-owned program, like we see mostly in Nigeria, where even chiefs, the community health promoters and this chief program of NPHC is basically a government thing. So we need to get even the partners, let them take ownership of it. Let local communities take ownership of it. They will genuinely take ownership of it, not parroting ownership. Because that's what Rwanda has done, and it has helped Rwanda's health system galvanizing to the level where even their dashboard, the minister at any point, my good friend Sabine Sanzimana, the Minister of Health of Rwanda, he can actually see all to downstream to the primary healthcare facilities in Rwanda, what is happening and in real time from the dashboard. So they've gone very far, and it's all about this involving all elements of the health system, So, and this, what this does, that it helps to improve the results that come out of that health system. It increases access. It also makes sure that those in hard to reach communities are also carried along, and also there's significant reduction in the child mortality rates in Rwanda. So, and they have zipline too for technology of drone technology for moving commodities to rural areas where they are hard to reach or where time is of essence, in that. And some other countries are very replicated. I know the state in Nigeria, the point was trying to do the same, So the second case studies are public-private partnership in healthcare, and there's a classical case the one of Lagos State government and farm access, that has enabled Lagos State to revamp some of its primary healthcare facilities, and it's based on a policy of government of Lagos State, that enabled farm access to partner them to rejuvenate some of the primary healthcare facilities in Lagos. And the same thing in Delta states, where I believe my big brother Philip is from Delta. At a point to farm access stay work also with the Okoa government in terms of healthcare facilities in that state. And I know Dr. Joy did a lot of work around that, in terms of trying to galvanize some of the primary healthcare facilities to become more vibrant, more responsive to the needs of the people and all that. So then the other case studies that I want to also bring here are Kenya Civil Society Advocates for Maternal Health is a classic one. What happened is that Kenya Civil Society organizations such as Center for the Study of Adolescence, CSA, and other partners gathered together and advocated for certain maternal health policies, which included things like respectful maternity care. And they did this through community engagement, through grassroots campaigns and collaborations, and got policymakers involved. And to this day, they successfully influenced the development of policies, several layers of policies that have been able to help Kenya in terms of beginning that work towards reducing maternal mortality, improving the outcomes for women in health facilities and even at the community health system level. So this is stakeholder-driven approach that contributed to increase awareness and also improve healthcare services and a decline in maternal mortality rates in Kenya. So, and the fourth one I also talk about is also the one around South Africa's philanthropic support for HIV/AIDS. Philanthropic organizations like Desmond Tutu HIV Foundation have been pivotal in terms of health policies related to HIV/AIDS in South Africa, and also bridging those stigma at the point where a lot of South Africans felt stigmatized with HIV/AIDS, and they also were able to galvanize funding and expertise that supported comprehensive prevention and treatment in terms of also awareness program, So this is important. I can tell you that's a major one, because when I was in the university, I started the first NGO, campus-based NGO, University of Jos, Mega Health, that was doing HIV awareness campaign on campuses in Nigeria. That was the first that was done in university in Nigeria. And I can tell you the uphill task then, there was in the early 90s, and it's mid 90s, early and mid 90s, and you can imagine what uphill task was when people felt that HIV was a death sentence and all that. Before Dr. David Ho came out with his cocktail of revolutionized treatment for HIV/AIDS globally. That was around, I think that was around 94, 95. So you can imagine. So this has had a lot of impact in South Africa in terms of this HIV epidemic and the burden. And it's a collaborative effort. And they work closely with government, work with partner donors and all that. So all these case studies show how stakeholder models can be important in how policy environment it goes in terms of how stakeholders can shape policy, implement effective policies in Africa, and where through government, they can also be able to get commitments for partnership, like public-private partnership, public-private philanthropy, public-private people partnership, all sorts of names. But most importantly, like I said, we need to tap into the opportunity in terms of policy around how do we get our philanthropists to be more involved in shaping our development of our healthcare environment. So that's very critical. So, and I want to also talk about one other thing. This is about empowering communities and engaging traditional healing. This, if for those who may not be aware, if you look at artemisinin, the drug artemisinin is actually from a Chinese herbal drug, and because the Chinese have been able to do good research around their herbal medicine, they've been able to bring a couple of things. Even acupuncture is now recognized as an alternative form of medicine that is accepted even in orthodox setting. So we need to get to that level in Africa where we begin to really do deep research in terms of this. There are a lot of hoaxes there, and there are a lot of fake people parading themselves as healers and all sorts of things, and giving people all sorts of roots. But there are some of them that genuinely may have something to offer. They may not understand the science of it. It is not left for us through research to be able to look at this. And this involves also engaging communities to be able to bring out tease out some of this information. Because it's through that engagement of communities that we'll be able to listen. Because the communities go to these people. We need to be able to sanitize that arena and make sure that there's evidence to an extent in terms of all this, and remove all the mythology around them, or the magic, voodoo talks around. So some of them are just basic plants that have very potent chemicals in them that we just need to isolate them. So, but there may be other things which this is not my space, and I'm not an expert on that. So, but we need to be culturally sensitive in terms of looking at medicine from a holistic side. And one of the things my academy, the Academy of the Institute is doing is encouraging our fellows to be also looking at health from a more holistic level, so that we do not lose out some of those opportunities that are there in terms of how we can develop policies to make it more robust for our healthcare needs in Africa. So then I want to talk, before I round up, I want to talk about leveraging technology for health policy. Yes, technology has its role in health policy, and like I mentioned, there are a lot of digital health initiatives now that are going. If you go for health tech, the Africa Health Tech Summit, which holds in Rwanda annually, you'll be amazed at the things that are going on. We are in that what they call the M-Pesa moment of health tech, the same way that M-Pesa was for what you call it, fintech, for the financial access initiatives for the industrial, for the economic part of governance model around access to finance and all that. So this is the period where Africa is looking at how do we leverage on technology to be able to use. And technology in itself, in the age of AI, can help us make our our use of policies better, more robust, and enable us to even track policies and be able to be part of our implementation research in order to tease out the things where there are challenges, where there are bottlenecks, barriers, and what we think would be strategies based on analysis that can help us move our way forward in terms of it as a continent, and also help us in terms of enhancing access, data management, and the general policy implementation, making sure that it's more efficient. So we need to embrace technology. It has to be a cornerstone of creating a more resilient, patient-centric, and future-ready and future-proof health system across our continent. Without that, I think we will probably be walking behind other continents around the globe in terms of how we've been able to use technology to be able to shape our policies in a way that are more responsive to our needs. I also want to add that for future directions and opportunities, we need to remember that Africa has been churning out new ideas. And if you look at the new public health order of Africa, which is championed by the Africa CDC and the Africa Union, and if you look at the digital transformation strategy of Africa, like looking at getting Africa fully immersed in technology by 2030. And if you look at the longer Africa agenda, which is longer than the SDGs, which is what we call the Africa One, which is Agenda 2063, you will find that Africa genuinely has begun a work. It's not perfect, but we need to, as stakeholders are emphasizing that stakeholders will begin to support that work. And that is where all these things converge to how we, in health, are able to get the right stakeholder groups, get stakeholders to buy into ideas that speak to the overall growth of Africa, and this is very key, So when you see the slides, sorry, I moved on rather than just wasting time on the slides. So when you see the slides I will share, we have basically most of the graphics so that you are not bogged down now by graphics and all that, and the weights of and the bandwidth challenge. So I'll leave it here. I think I'm ending on that note of future directions and opportunities for health policy in Africa. Thank you very much.
Well, thank you so much, Dr. Francis. I can see the passion. I've always loved the energy from the first time I had a contact with you during our induction, during the induction of the HLLP, and such a privilege to have you. And even going through your presentation, it was so thought-provoking. You were able to go through several aspects of it, breaking down. In case you're wondering what topic did Dr. Francis focused on, he focused on the role of stakeholders in the advancement of health policy implementation in Africa. And when he talks about the stakeholders, he was able to talk from the perspective of the policymakers, as well as the government, as well as the civil society, as well as the philanthropies, as well as even the community entirely. And it was like somebody just dropped in the comment section. It was a great talk. It was a great presentation. And this is more than the talk. It's a presentation. This is like, you were able to give us the facts and figures alongside with the case studies. It was very deep. I even myself, at the point, I just had to turn on my video to let you know that we are literally all following, and not just that we're looking at the side, we're following you attentively. We saw the facts and figures, and then you were also able to give us a practical side of what is happening. And like I said, I love one of the points that you gave is that Africa is making progress. I mean, we're making progress. And the fact is that we just have to join. We need to consolidate our efforts. We need to join our hands together. I love the fact that you cited several examples. If I said I should start mentioning one of them, I'm sure I'll have to reiterate. Well, thank you so much, Dr. Francis, for that presentation. Before we I would like all our speakers to actually take some rest. We're going to be going to the question and answer section. But before we go to the question and answer section, I still want our speakers to actually take in some brief breaths. It's been a practical side. What we're having today, the kind of presentations that we're having today, is not just the talk. It was from the active part of it. And before I actually bring the participants to actually ask their questions, I would like to say that participants, dear participants, I saw that somebody just asked questions that, how we muted? Yeah, it's not that you were muted. The platform they're using is a Zoom webinar, and then for the sake of to avoid distraction, we just had to remove the command for I mean the voice command, I mean the audio command for our participants. But don't worry, we have the intention at least giving 1 or 2 person ability to, I mean, to enable their mind to talk. All right, so in our webinars, over the years, and not just even the months, over the years that we've been organizing this webinar, we've had both people that are playing their role in the ed sector that are inclined towards the science, I mean the ed sector. I mean, we've had people, I mean, people that don't even have any, I mean, the whole COVID scenario has brought everybody to want to understand what's going on in the ed sector. There's some terminologies that Doctor, I'm going to be directing this question. It's just like a little enlightenment. You mentioned 2 terminologies, Dr. Donna, that I want you to actually just, just maybe in 2-3 sentences, I want you to just shed more light to it. Number 1, you mentioned the JEE, which the figures that you mentioned is very striking, that in 2017, Nigeria was occupying, I mean, has a score of 39%, but now in 2023, we moved to 54%. I'm sure a lot of people are wondering, what is JEE? And then you also mentioned about the International Health Regulation, which is IHR. I do understand it, but for the sake of, like you said, communication gap, a lot of people don't know the terminologies. Dr. Francis also mentioned that a lot of people don't even know what they are saying. I remember you mentioned during your presentation that when we were talking about the passing of the domestic violence bill, people don't really understand what the bill, what domestic violence bill. All they just know that it's going to affect the men, like you just mentioned. So just to break down, at least let's start demystifying all of this terminology. So Dr. Francis, Dr. Donna, Dr. Fini, so please, can you let us know what is IHR? What is JEE? I mean, so yeah, the floor is over to you.
Thank you very, very much, Ms. Ifeoluwa Alabi, for excellent moderating. Thank you so much. I also want to thank Dr. Francis for excellent work he just did now, very excellent. Let me remind him that we are together in Lusaka, Zambia. I was actually sitting with the Commissioner for Health, River State, when you called that up to present that award. So well done, sir. Well done. Well done.
Thank you.
Yeah. Joint external evaluation is a WHO tool for evaluating the level of preparedness in a country level to actually prevent, respond, and detect infectious diseases. It's actually a tool that is centered around the global health security agenda in such a way that we're able to actually assess the country preparedness to respond to some of these health emergencies. And it's also try to actually assess our health systems, because at the end of the day, it's a multidisciplinary approach where all the stakeholders within that space are actually assessed. But for the JEE, it's 19 thematic areas. Areas are like laboratory strengthening, our surveillance system, biosafety and biosecurity, communication. All these are areas that they actually assess. And the secretariat for that assessment in Nigeria is the Nigerian Center for Disease Control. They are the ones that coordinate all these multi-agency projects. You see, during that JEE, you see agencies like the NCDC, the MLS, Medical Laboratory Science Council of Nigeria, Nigerian Biosafety Management Agency, Nigerian Biotechnology Development Agency, Standards Organization of Nigeria, NAFDAC. All this is a multi-agency project where everybody will come to the table and support the government projects. Agencies, to even Office of the National Security Advisor is involved, Interpol, the Nigerian police, the military, everybody is involved. And we are all there. But one good thing is that the WHO will give you the opportunity to actually assess yourself internally. So there's an internal assessment where stakeholders will come together and prepare for this external evaluation. You present the report to WHO, they will read the report and now come armed with the report that you said this is the position of your health system. By the time they come, they're going to be coming with experts who will now go to different thematic areas and assess what is on ground. They will assess your documentation, they will assess your preparedness, they will go to sites. In fact, they went as far as going to Port Harcourt, going to Sokoto, going to Lagos and assess what is on ground. So it's not about what you documented, it's about what is on ground. And it's not about one powerful individual doing everything. It's about institutions. They are looking at how strengthened our institutions. Are institutions prepared to respond to these public health emergencies? So they are not looking for very powerful individuals, they're powerful institutions who are resilient institutions who are able to respond to public health emergencies. Now, coming to international health regulation is also, in fact, there is a full-fledged department within WHO on international health regulation linked to global health security agenda. The international health regulations, like you have go to NCDC, for instance, they have a department on international health regulation because there are a lot of health regulations globally. There is Agenda 1540 of the United Nations, the Biological Weapon Convention, and the rest of them. So it's important that stakeholders are aware of some of these international health regulations, like Agenda 1540 of United Nations Security Council, the Biological Weapon Convention, and all of them. All these international health regulations, it's important that we are aware of them. And at country level, for instance, we have a secretariat for Biological Weapon Convention, for instance, at the office of the Secretary to the Government of the Federation. That is the secretary, and they submit what we call confidence building measures to Geneva. At Geneva every year, every April, they submit the confidence building measures. They ensure that people who are working with biological agents are able to be are accountable, and they're able to ensure that these biological agents are well protected so that it doesn't fall into the hands of people who can use some of the biological agents to cause havoc in society. So these are some of the terminologies that are used within this space.
Thank you.
Now that we are just before you go to the next, there is a question on the chat box directed to me.
Yes.
Somebody asked that what can I recommend as a way forward for pharmaceutical companies who are leaving Nigeria to other countries because of policy changes or because of issues within the country. I will say that we shouldn't be looking at Mr. President or looking at me because we are all leaders. We should be able to provide solution to some of these issues. Take, for instance, the issue of pharmaceutical industries leaving Nigeria. Government should be able to provide incentives or bailouts when a company is in trouble, because people are losing jobs, and of course these companies are leaving, and these companies leaving are not able to pay tax to government. So issues of incentives to some of these companies, when we hear that they are in trouble, government can do bailout. It happened in the US when the auto industry in the US had issue. The US government provided the funding bailout to ensure that they're able to stop job losses and that the economy continues to be vibrant. So Nigerian government can actually use this to actually keep some of these companies, introducing incentives and giving them bailout so that we can keep our jobs and that the economy can continue to boom, and the citizenry are also happy to enjoy the dividends of democracy. Thank you.
Thank you so much, Dr. Fini. I mean, I thank you so much for shedding light on the terminologies and also for giving an accurate answer to the question that I was asked, because it's one of the exit of some key pharmaceutical companies. Thank you for that answer. All right, so we also have another question here that I'm going to be directed. I mean, Dr. Margaret, yeah. Dr. Margaret also directed the question to our second speaker. But before I read out the question, if you would like to actually ask your question directly, I'm just going to be giving two persons opportunity to use their mic. So what I would just say is that once I give you opportunity to use your mic, I know your questions are a lot. Please, let's avoid abusive words or demeaning any government. Let your questions be straight and direct. So if you want to answer your question, want to ask a question directly, please do raise up your hand. I will activate the microphone to you. All right, so we have the second question. Says the second speaker, has touched on the key issues of transparency, accountability, monitoring, and evaluation to drive effective performance. Until these are given the needed prominence, I'm afraid there won't be a systemic. Okay, that's like a comment. All right, somebody say it's obvious that the policy are made on every issue implement. Implementation is a major problem. It's a lack of good leadership. What the speakers can suggest to be the solution to this problem. All right. I'll just ask if Dr. Okay, all right. She actually commented. So, Dr. Francis, what do you like to say about leadership? Somebody just said that, I mean, all the conversations is still hinge on the leadership. I know you have said a lot on how the leaders can be brought, in the light. I mean, so I would like to just say that if you have any comments on that.
Yeah, okay. So without going into a treatise on Nigeria's politics and without belling any cat in the political space, I think the challenge we face is a common challenge across most developing countries. If only a few have been able to surmount it. And that's the challenge of the fact that leaders are often disconnected with the reality of their people. And funny enough, they come from the regions. And one of the ways we can begin to reduce that kind of gap in terms of that nexus with our leaders is also just what we've talked about here, a stakeholder arrangement and models that are strong and able to hold them accountable until we're able to get a counterpoint for them. I remember enough is enough at the point, had this coat of arms, and a lot of Nigerians missed the message when they had this coat of arms that said Office of the Citizen of Nigeria as the most important office, which is true. How many Nigerians think of themselves as the most important office in Nigeria rather than the president of Nigeria? We need is that call in terms of how we ideate, how we process the idea of our citizenship. That's our problem. And if also at organizational level, it's the same problem. Like Dr. Philly was talking about organizations that are living. For me, I also think that also dovetails into this discussion. Why are Nigerian organizations not trying to fill those spaces? For every vacuum, something must occupy it. Why not use the opportunity to also step in, move your game, get your A game, and see it as an opportunity to listen? Because no matter how bad Nigeria is, there are people who are making money in Nigeria. I mean, Dangote is making money, Boy is making money, without mentioning all their names. Some people are making money. So for me, I think apart from giving those, just to add to what Dr. Philly mentioned in terms of incentivizing them and all that, I think we need to look at infrastructural improvement in terms of our society itself. Can government be able to work with private sector to improve infrastructure in such a way that it makes sense? Power is one of our biggest problems, and it's affecting pharmaceutical companies in all this. And no matter what we do, and we don't get power right, because profit margins are low, they will not be competitive in a global market space because the amount of energy they spend in terms of getting those products to the market, it's a big problem. Then issues of collaboration and partnership still resounds from what I mentioned earlier and all that. So back to it, leadership also is an issue of we often don't have well systematized organic processes that grow leaders. The only leadership organic processes that are well systematized are either like in professional organizations or professional groups like whether the health groups or just organize this. They grow leaders in a sense. And then the military, but there's something that is lost because these people are still coming from the same society that has lost that function of understanding what their role is as a citizen. So it comes to play even when they are leaders. They lose track of what it is to be leaders and to shape policies in a way that speaks to the people. It's all about themselves. So these are some of the challenges that we are burdened with as developing country. And people like Lee Kuan Yew in Singapore was able to understand the dynamics and shape them in such a way through policy, through hard-handedness too, whether you like it or not, by not being a gentleman, to get their countries to work. Paul Kagame is doing the same thing in this thing. So every country has its own unique experience, and it's time that our leaders begin to understand some of those handwritings on the wall and how to shape those policies in a way that speaks to our needs. I'll leave it there for now.
All right, thank you. Okay, thank you so much, Dr. Francis, for shedding more light. I think from the last, your comment also kind of did justice to this person question says, how can we solve the local adapted drug policies in terms of production and deliveries? I mean, you talked about it during your while you're answering it, collaboration, we stepping up to our game, like you said. I mean, I love the comment you gave that for every challenges, there are positive and there are negative side to it, but it all depends on your perspective on how you see it. I mean, if a space has been created, that means that's another space for somebody else to feel it. And instead of you seeing it as why people are leaving, why don't you say like, okay, some other people can actually, fill up the space. Okay, I have somebody actually raise up our hands. I'm just going to quickly do that. I just found out that we're rolling out.
Sorry, you asked me something.
Can I respond to?
Yes, sorry.
Can I respond to?
I wanted to.
Okay.
Yeah.
Yes.
Yeah,
Dr.
thank you,
okay,
Dr. Francis, for that response as well. There's a question from my friend, Professor Jubre Sangare from Mali, and he was asking about how do we support local production of drugs and pharmaceuticals within the continent. I think that is a brilliant question because more than 90% of the drugs consumed in Africa are imported. And that is a huge challenge for us as a continent. We are losing money. And so there need to be policy shifts to support the local manufacturing industries within the continent. You remember when COVID hits, the vaccine politics, Africa was not able to vaccinate as much initially because the people manufacturing the vaccine were outside Africa, and they needed to take care of their citizens first before taking care of our requests for. So we need to support our local manufacturing industry to have the capacity to actually produce locally for our citizens. There need to be policy shifts. It takes a lot to set up a pharmaceutical plant. And if there are no guarantees, if there is no patronage, if there is no specific policy shifts to patronize some of these pharmaceutical industries, they will also cease to exist. So government should be able to guarantee that if they're able to manufacture, they can mop it up on the market and keep them in business. But not a situation where we prefer imported products than locally manufactured. And some of them locally manufactured products are also good, but because of that mentality that we are over-fixated with imported products, so it becomes a challenge. So there need to be policy shifts to support the local industries to continue to remain in business. And when there are incentives around manufacturing, people will see that incentive and come into the business. But right now, we don't have enough support for that industry, and that's why people are not attracted to it. We have the best hands within the country. We have a lot of experts within the continent, leaving the continent now because there are no opportunities for them to actually put in their best in whatever they are doing. So there need to be policy shifts both at national level, at continental level. The African CDC is doing a lot to actually attract investment. They are doing a lot to actually support local manufacturing of diagnostics, of pharmaceuticals, of vaccines. And I think they need to be supported, and that and this kind of support should come at the level of the heads of government within the continent. It should also cascade to the African ministers of health to start this conversation, support the local industries. And again, it is not enough to support local industries. We shouldn't kill ideas. What do I mean by that? When somebody starts a plant, you discover that within a space of how many kilometers, even though it's across borders, you see another kind of major competition coming up. But if a local manufacturing plant for a diagnostics, maybe starts in Nigeria, I think a country like Ghana can start something else and not duplicating what already we have. Or if Nigeria is producing vaccine, for instance, maybe for polio or for cholera Ghana should be doing something else, or Guinea should be doing something else, and not competing among ourselves. And there should be that kind of trade between these countries to ensure that products can move from Nigeria to Ghana and vice versa. And we can easily support ourselves, buy from each other. And before you know it, the Africa business environment will be better for it. Thank you.
Thank you so much.
Thank you, Dr.
Yeah.
Philip, for
Over
that.
to Dr. Francis, please.
Yeah, thank you, Dr. Philip, for that. I think you've said it all. But let me just give an example, because this is a learning curve for all of us, and there's a lot of young professionals here with us. So in between 2013, 2015, I actually kind of coordinated a UN program under a USAID project called TSHI, Targeted States High Impact Project, which was operating in Sokoto and at the Matani Bonachaya project in Nigeria. You know, so I headed, but my position was also tied, had like an umbilicus to the UN under the RMNC Trust Fund, what they call the RMNC Trust Fund. And what did we do? Ban Ki-moon, the then UN Secretary General, had encouraged countries to produce, if possible, produce some drugs. Known, there are 13 commodity areas. They could produce some of them that were life-saving. And it was under the UN, the policy was under, that's why it's policy. It was a global policy under the UN Commission for Life-Saving Commodities for Women and Children, UN COSEC. And incidentally, Jonathan Ebele was the co-chair with Jan Stellenberg, former Prime Minister of Norway. So they were the co-chairs of that commission. And I headed the component here in Nigeria, but it was a global position. And one of the things we were able to achieve with partners like CHI, WHO, and all that under this project, and with some funding from Gates, to do what they call learning excursions for states to Sokoto and Bauchi. One of the things we were able to achieve was to get pharmaceutical companies in Nigeria to start producing chlorhexidine for the first time in Africa. Nigeria became the first country as of 2014 that produced chlorhexidine for cord care, because we had moved then under the Every Woman, Every Child initiative of the UN. The gold standard for cord care of newborn was no longer alcohol. It was now chlorhexidine, and we were able to get chlorhexidine produced locally here in Nigeria. In fact, the first company that produced chlorhexidine in Nigeria, the prototype that was ready for market.
It's getting too long now. Sorry, Dr. Pajubi. Can you give that same man my bag to bring for me here? I will.
Hello. Okay, sorry. So I thought Ophelia was talking to me. Sorry. So, and I was able to go with the MD of that chlorhexidine firm in Nigeria, who had now been certified by NAFDAC at that time, to New York for a meeting of the Global Chlorhexidine Working Group. And there and then he presented the fact that he was already producing chlorhexidine in Nigeria. At that time, he had interest from UNICEF, from Liberia, he had UNICEF, Haiti. They were all very interested to see how they could buy chlorhexidine from Nigeria. You see, so that was an opportunity itself. And at that time, the biggest producer of chlorhexidine outside Africa was in Nepal. You know, so, and at that time, Nigerians were willing to be funded to go and do what do you call it, like a study visit to Nepal. We said, no, we have gotten samples here in Nigeria. Come and do study visit to Bauchi and Sokoto State and see how we are using chlorhexidine in communities for women who are just put to bed. You know, so it was very exciting. And Nigeria became first country again in Africa to have a globally certified, what you call amoxicillin DT, dispersible amoxicillin tablet. That's amoxicillin tablets that if you drop inside water, it dissolves. It's used for treating childhood pneumonia. You know, Nigeria became the only other country that was producing at that time was in Uganda, and they were only producing for inside Uganda. They couldn't export. But Nigeria had the qualification. Companies that produced in Nigeria then had the capacity and recognition to be able to export their product beyond the borders of Nigeria. So you see, these things are possible. But what made it possible, like Dr. Philly alluded to, was the fact that when we had the stakeholder meeting that enabled for purchase of this, we made sure that government agreed through what was known then as Shopee MNCH, the Shopee program then, the Subsidy Reinvestment Program, agreed under the NPACD to buy some of these commodities for primary healthcare centers across Nigeria. And that galvanized private sector because government had given them assurance that they were not importing it from outside Nigeria, that they were buying it locally. So some of these things are no-brainers. It's just that we have people who are not genuinely patriotic about Nigeria. So they do things the way they want, and some of them are in high offices. So these are challenges that we hope with time and we can overcome them. So, but then the other thing you asked before other questions came up, you asked the meaning of, I talked about GBV, gender-based violence, or VAW, violence against women. What the act, it wasn't an act, the proposal then was for a violence against women act. It came as a bill, and then I said it never got to the final reading and it was never passed. But the good thing that came out of it, it started a process that midwifed what is known as VAP bill, the Violence Against People and Provision Act, which now encompasses all kinds of violence, especially against women, against even men, against people who are disadvantaged in any form. So that act now came later. That was, I think, 2017. They passed the VAP bill, VAP bill into an act. But the Violence Against Women bill never saw the light of the day beyond that. So it never got passed. So just to clarify, that wasn't passed. So we now have VAP, which was like a full-on to the whole movement to get that kind of law in place.
Thank you so much, Dr. Francis. Thanks so much, Dr. Fidi. I know we've actually spent a lot of time here, but please do give us the next 10, 15 minutes to be rounding off. Okay, I've actually said my words, so I have to fulfill my words. So Dr. Margaret Maffei, please, you can unmute and ask your question, please. Yes. Dr. Margaret, can you hear me? I've authorized the use of your microphone.
Thank you very much.
Yeah.
This is an exciting topic. And to me, it seems as if we're just repeating ourselves decade in, decade out. For me, if you have a focus, you must make sure that right from the grassroots, from the foundation, things are put in place that you monitor over time to ensure compliance with policy. Vice versa, who is harvesting the research outputs from our public sector? Nobody's doing it. And when the public sector, what I mean is that the Public Research Institute, etc., when they submit their plan for funding every year, who ensures that the plans are in conformance or conforms with set policies and responsive to what is needed? It's hardly done. Then secondly, there's no networking. If we network, things will move faster than we think. I wish to recall what happened during the malaria issue when we were recording resistance to chloroquine. Because of a renowned professor of pharmacology who harnessed and did a multi-center study on response to chloroquine, we didn't emerge. We couldn't have emerged with artemether or artemisinin-based therapy. They collated the result, and that was able to influence policy to change malaria therapy or management from chloroquine to artemisinin-based therapy. And I think the gap is still there. People are doing researches in different research institutes. Nobody is collating or harvesting or even close networking. Secondly is the issue of manpower. There's no point in setting up institutions and not enabling them. Most of our key brains they're exiting this country, and it's still ongoing. I don't want to start mentioning specifics. They train so many doctors. Before you know it, they're all applying to go abroad. Nurses, all different cadres in the health sector. We need to look at that. And there's frustration of our young ones who have entered the service, believing that all the wherewithal will be there for them for innovative engagement. But they're disenfranchised until we look at that. And every time an institution comes with a report, annual report, we're always sending an annual report, who appraises them to see whether or not they're conforming or not? How do we get them back online to ensure we're doing the needful? I could go on and on. Truths were created to focus on the health needs of the communities. Choose eventually left the communities because infrastructure did not motivate them to stay. So there's so many myriads of areas we need to look at. Above that is knowledge management. How are we managing the knowledge accruing from all these institutions? Are people, are they complying or responsive to priority research areas that will move the nation forward? And so on and so forth. Thank you.
Thank you so much. I can see that everybody is so passionate about this topic and we want Africa to work. All right, I don't know. I think before I actually have final words from our speakers, I would like to also, I have my boss on the call, Dr. Ayodeji Babade. Sir, can you hear me? Maybe have something to say to the topic on ground before we have final words from our speakers. I think he has been with us since. Okay. I have him.
Yeah, good afternoon, ladies and gentlemen. Let me start by wishing everybody compliments of the season. I'm so happy that we're having the last webinar for this year. And I was just thinking about it now. This webinar started about 4 years ago in response to the serious misinformation we had during COVID. And for about 4 years, we've been privileged to host this webinar constantly, and it has become one of the biggest platforms to discuss issues around biosecurity and One Health in Africa. I recall that there was a particular edition that we had almost 500 participants from about 50 different countries. That shows the level of interest people are having in this webinar now. And I must thank my very good brothers, Dr. Ophelia, Dr. Francis, for capping up the webinar for this year. Your presentations have been very, very fantastic, and that showed in the level of contribution that we've seen from our audience. I appreciate your presentation. I appreciate your time. No, what you're doing for us is pro bono. If we are to pay for this, I'm not sure my organization have the financial capacity to pay for such experts that we're bringing in. But thank you very much for giving us your time and for sharing your expertise with participants here. We look forward to working with you and your organization next year. And I wish you a very Merry Christmas and happy 2024. And to our participants that have stayed with us for this webinar, and that has been with us since January. It's great having you. Without you, there will be no webinar. You are the reason and the strength why we continue to do this every month. And I assure you that next year we're going to improve on what we're doing. It's going to be bigger, it's going to be better, and we're going to create platforms like this. There is need for platforms like this in Africa to discuss emerging issues in area of biosecurity and One Health. There's so much challenges facing us in Africa. And there's nobody that will address the challenge of Africa but Africans. So it's always good to have platforms to bring the best brains in Africa to discuss emerging issues and see how we can work together to find solutions to these challenges that is ravaging us as a continent. So thank you very much, everybody, the speakers, participants. We love you. Thank you for making this small dream a reality, and we'll continue to do more next year. We look forward to more collaborations with you, your organizations, and many other organizations within the continent to make the continent a very wonderful place for all of us, and a place we'll be able to live for our children, generation yet unborn. Thank you very much for your contribution. Happy Christmas and have a blessed 2024. Thank you very much from our side.
Thank you.
All right, thank you so much, sir. All right, so let's have a final word from Dr. Ofili and then Dr. Francis, and we call it.
Thank you.
Dr. Ofili, do you have any final word?
Yeah, thank you. I also want to thank the JET Consortium for inviting me to share my thoughts on this particular topic, and it has been a very good conversation. And I also want to thank my co-panelist, Dr. Francis, for sharing his thoughts and everything that he has said. I've also learned so much from from some of the things he said. My advice is that we should continue to have this conversation, both at national and regional levels. A lot is happening at national level, a lot also happening at the regional level. I don't know how many of us are aware of some of the work of West African Health Organization, a specialized agency under West African, under ECOWAS. A lot also happening at the regional level, African CDC and global level. So let's continue to network and have this conversation. And within this conversation, we'll continue to find solutions to some of our problems, especially around the global health security. And Africa should not be left behind in this conversation. A lot is happening at global level. And we don't have a separate market for Africa. It's a global market for everybody. So we should join the conversation and continue to engage. I wish everybody Merry Christmas and a prosperous New Year in advance. Thank you all.
Thank you, Dr. Philly. Over to you, Dr. Francis.
Yeah, thank you very much. I'll put the same line with my brother, Dr. Philly, and I think it's a pleasure working with him on this call. And I think one of the things that Gets should do, moving on with this, is that I think like rather than reinventing some of these ways, it's possible to even have a session at CPHIA that looks over the years what you have been able to, the granular layers of the work you've done, to have a panel to discuss some of your findings from all this work you look at it at a research end, all these webinars you've been having since COVID and where we are, and some of the outputs can be something that can be presented to Africa on a panel at the level of CPHIA. So that's just a suggestion. And my institute will be willing to partner with you on that. So that's important. And then one of the things I want to come with here is a call to action. Stakeholder is what can help us change our outcomes in Africa. Stakeholder, because if stakeholders gear up and are able to nudge government in the right places and able to drive a common agenda, government will change. Some of the shenanigans we see in terms of policy abandonment, I'll call it that way, because if it's not implemented, it's abandoned. So as I'm concerned, it's just only there in name. So some of those things can actually be managed from a stakeholder level, getting stakeholders to rally around some of these policies that we have. We have beautiful policies, but implementation still is the main challenge, like somebody even posted on the message. So it's a call to action for all of us. Consider it a call to action. In our own little ways, we cannot be part of this movement to make sure that policy works. And stakeholder is the basis that we can use to drive a common agenda. Thank you very much.
All right, thank you so much, Dr. Francis. I think just like what my boss has said, thank you so much to all of our speakers. I mean, to Dr. Philly and Dr. Francis for joining us. I know you do have a busy schedule. A lot of people haven't rounded off for the year, but you still find time to come and join us for honoring our invitation. Thank you so much. And we do look forward to having a collaboration with you next year, just as my boss has mentioned. All right, I also want to say thank you to our participants once again. Thank you to everybody that engaged. Thank you for asking your questions. I can see in the chat box that we have people join from Philippines. We have somebody join from Ethiopia. We have somebody join from Liberia. We have someone join from Morocco. We have people keep joining us. We have someone joining us from UK, and I'm sure that more people joining us from different parts of the world. Without you, we cannot keep having this webinar. And we do hope that, just like what Dr. Francis has said, we're able to present all of our findings on the global scale, because indeed, this is not just a local webinar, this is an international, a global platform, and everybody's making use of it. Oh, we just have somebody join us from Cote d'Ivoire. Thank you, everybody. Thank you. And I think on this note, on behalf of the staff and the management of GET Consortium, I would like to say Merry Christmas in advance and Happy New Year. We wish you a beautiful, beautiful end of the year. And also we look forward to having an amazing 2024 with everyone. Good day. Thank you. Thank you. Thank you. Thank you. Enjoy the rest of your day. Bye.
Thank you.